Predictive rules for optical diagnosis of less than 10 mm colorectal polyps based on a dedicated software. Introduction. Detection rates for neoplastic lesions at screening colonoscopy are increasing rapidly owing to improvements in endoscopist performance and technology. Up to 84% of screening colonoscopies end up with the detection of at least one polyp, which in most cases is a diminutive lesion, 5 mm or less. Until recently, it was recommended that all retrieved specimens were sent to histology in order to classify such diminutive lesions as either hyperplastic or adenomatous. However, the risk of advanced neoplasia and invasive cancer in these lesions is marginal, being rare and exceptional, respectively. Electronic chromoendoscopy associated with high-definition colonoscopy and, possibly, optical magnification emphasizes the vascular and glandular pattern of colorectal lesions, leading to an in vivo prediction of the histological diagnosis. The adequate accuracy achieved by these methodologies in preliminary studies resulted in official recommendations for its use as the standard of care in clinical practice. In detail, resect and discard and leave in situ strategies based on high-confidence optical predictions have been recommended for diminutive adenomas and rectosigmoid hyperplastic polyps, respectively. In order to standardize optical diagnosis, international classifications for in vivo prediction of polyp histology, such as the narrowband imaging, NBI, International Colorectal Endoscopic, NICE, and Japan NBI Expert Team, JNET classification, have been validated and incorporated into clinical practice. These classifications are mainly based on vascular and glandular patterns, and differing results have been shown with their implementation in the endoscopic community. Recently, specific features of the polyp surface have also been shown to predict polyp histology. The valley sign, a slight pseudo-depression on the edge of the polyp, has been shown to be highly specific for the diagnosis of adenoma, while a cloudy or irregular appearance and indistinct borders have been associated with sessile serrated polyp histology. By incorporating both surface and vascular and pit patterns, Hassan et al. Created a new classification, the Blue Light Imaging, BLI, Adenoma Serrated International Classification, BASIC, for optical prediction of polyp histology. The aim of this validation study was to quantify analytically the strength of the basic descriptors individually and when combined in predicting polyp histology, and to use these data to create new basic rules for classification of adenomas and hyperplastic polyps. The secondary aim was to evaluate the diagnostic accuracy of such rules for the diagnosis of adenomas when used by experts. Background. The basic classification for predicting in vivo colorectal polyp histology incorporates both surface and pit and vessel descriptor domains. This study aimed to define new basic classifications for adenomatous and hyperplastic polyps. Methods. A video library, 102 still images and videos of polyps measuring 10 mm or less using white light, WLI, and blue light imaging, BLI, was reviewed by 7 expert endoscopists. Polyps were rated according to the individual descriptors of the 3 basic domains, surface, pit, and vessel. A model to predict polyp histology, adenomatous or hyperplastic, was developed using multivariable logistic regression and subsequent leave one out cross-validation. New basic rules were then defined by Delphi agreement. The overall accuracy of these rules when used by experts was evaluated according to the level of confidence and light type. Results. The strength of prediction for adenomatous histology from 2,175 observations assessed by area under the curve, AUC, 95% confidence interval, was poor to fair for the surface descriptors, 0.50, range 0.33 to 0.69 for mucus, 0.68, range 0.57 to 0.79 for irregular surface, but stronger for pits, 0.87, range 0.80 to 0.96 for featureless, round and not round, and vessels 0.80, range 0.65 to 0.87 for not present, lacy, or pericryptal. By combining the domains, a good to excellent prediction was shown, AUC 0.89, range 0.81 to 0.96. After the definition of new basic rules for adenomatous and hyperplastic polyps, accuracy for high-confidence BLI predictions was 90.3%, range 86.3% to 93.2%, which was superior to high confidence WLI. 83.7%, range 77.3% to 87.7%, and low confidence BLI predictions, 77.7%, range 61.1% to 88.6%. Conclusions. Based on the strength of prediction, the new basic classes for adenomatous and hyperplastic histology show favorable results for accuracy and confidence levels.